Family building can certainly be a journey, whether it's a diagnosis of infertility, an interest in fertility preservation, or the need for advanced reproductive technology. Well, the Center for Advanced Reproductive Services can help with all of that. And one thing that's becoming more and more popular, women freezing their eggs. And joining us to talk more about that is Dr. Daniel Groh. Thank you for being with us.
Hey, it's my pleasure. Thank you so much for having me. It's nice to see you.
It's nice to see you. All the amazing things we can do over the internet now, as we've learned to do during the pandemic. You know, one thing, as we're letting people join this Facebook Live feed, I found it interesting. You and I were talking. It seems with the pandemic, it's become even more important for people to want to start a family. You've seen more people making inquiries. Perhaps it's really defined for them that they want a baby.
It's really interesting. You know, I'm not sure we would have predicted that the pandemic would make people focus more on their desire for family, but it seems it has. And maybe it's just being at home and being with your partner. But, you know, we know the incidence of pets has gone up, like people are adopting dogs and cats, and, you know, they want love in their household and companionship. And so we're also seeing we're seeing lots of couples seeking fertility services.
Yes, and let's talk about egg freezing, because it may not even be that a technical infertility case, which I know you guys are all experts in that, with in vitro fertilization, all of that. So it's a great resource if people are struggling. But you're finding more and more people want to freeze their eggs, and this could be for different reasons. Why would a woman want to freeze her eggs?
You know, there are several reasons, and the reasons are changing a little bit over time. You know, first of all, I'd like to say that the technology that enables us to freeze eggs well, successfully, so they can fertilize and function and grow into healthy embryos has really changed and dramatically improved over the last maybe 5 to 10 years.
Yeah.
Okay, this was an experimental procedure for, you know, much of my career. And over the last 5 or so years, it's become pretty routine, the technology. So we can successfully freeze an egg such that when it's warmed or thawed, it'll fertilize and grow into a healthy embryo, and that healthy embryo make a baby. So it's a big leap in technology.
And for the woman, I've been out there to the center and interviewed people who have done this. One reason a woman might choose to freeze her eggs is she's at a certain age where she wants to have children someday, but there's no partner in her life. And so she wants to preserve her fertility. My understanding is the egg, if you freeze the egg at 35, that egg is it's a nice, young, healthy egg. And one thing we haven't figured out how to do is stop the biological clock for women. So freezing her egg will give her opportunities in the future, but it's not like a lot of downtime. It can be rather easy, and sometimes insurance will even cover it.
All of those things are true. So, you know, as you said, aging isn't always kind to egg quality, right? So younger eggs have a little bit more fertility than older eggs. And so, you know, if women, you know, for example, they're professional women, they're really wrapped up in their career and doing well, and they don't have a partner, or the timing isn't right for them to have a child. So we'll often see that scenario where they come in and they want to put some eggs away. And so the process is we can stimulate the ovaries to make multiple eggs. And often the ovaries have many tiny resting eggs in the ovary. They're inside these things called follicles. So there are many resting follicles, and we can stimulate the ovaries over a course of about 10 days with injections of follicle stimulating hormone. And then these little follicles grow and mature and produce mature eggs that can be pretty simply removed from the ovary. So after 10 days of injections and a trigger shot, we'll do an egg retrieval under anesthesia, and the procedure takes about 15 minutes.
15 minutes,
and we
not bad.
retrieve these eggs, and then you may have 10 or 15 or 20 eggs that the lab will look at and prepare. They'll evaluate each egg to see if it's mature and freeze the mature eggs. So the whole process from start to finish to eggs in the freezing tank is usually about 12 to 14 days.
And a woman could still be working or keeping up with her life during that period of time.
Exactly. So we usually have, 3 or 4 times over that course of 2 weeks, you'll have blood tests or an ultrasound. We try to keep those in the morning so it doesn't interfere with, the patient's workday. And so most of our patients continue on with their normal activities.
So when's the best age? If women are thinking, gosh, I really would like to freeze my eggs because I'm concerned that I don't have that right person in my life right now. At what point do you really need to start doing it?
Well, the right age, may not be always the most convenient time for the patient. We get very happy when we're helping patients who are, still in their early 30s, because we know the quality of those eggs is so great. That embryos produced will have about a 50% chance of making a baby.
Mm.
If we accelerate to age 40, then each of those embryos might have a 20% chance of making a baby, or 25%. So there's a really big change in egg and embryo quality between 35 and 40.
That is a big difference, yeah.
It's a huge change, right? So it's close to or before 35 as possible is best. And a lot of folks have studied this and looked at cost effectiveness, and it's cost effective, assuming that you're going to put off childbearing for 5 years, is cost effective at age 37 and younger.
Okay.
But there are, we often see patients who are, around that age or a little older that, we can still get a good number of eggs from. And that's, that depends a little bit on ovarian reserve, or how many eggs are in those ovaries to be stimulated.
And that's something that you have done as well. If someone's listening to this and they're like, well, I don't really know anything about the quality of my eggs right now. You do some testing, which can test some hormonal levels, the FSH, and really give some women advice about where they are in their biological age.
Yeah, for sure. We can do, an FSH test on the 3rd day of a menstrual cycle, or an AMH test, anti-Müllerian hormone. And that hormone is probably the best correlate of how many eggs you would make if we stimulated the ovaries for this process.
That's the thing. We don't ever know how soon, will a woman enter early menopause, or how many more years of fertility she has left. So all we know, I guess, at this point from interviewing doctors like you, is the earlier the better. So this is good that they can get in. And also, if people are wondering, I know I interviewed someone at your facility who it was actually covered on her insurance. So sometimes it can be, right?
It can be covered by insurance. It's almost always covered by insurance. If there's a cancer diagnosis, so we have patients, unfortunately, with breast cancer, or with, Hodgkin's disease or lymphoma, or a whole host of other, problems where they may best undergo chemotherapy. And chemotherapy, in a nutshell, causes early menopause, causes some stress to the eggs. And one of my favorite ways of looking at it is that it ages the eggs by about 10 years.
Wow.
So if you go through chemotherapy, so it has a pretty dramatic effect.
I just want to,
yeah.
Oh, sorry, doctor. I was going to say, there's some people.
I just had to turn the lights back on in my office. Excuse me. I was sitting still for too long.
That's okay. I do have some comments from the feed, and I just want to say that Samantha is saying that Dr. Groh did my transfer, and now we have our little miracle. So people are chiming in of people who've gotten.
We're so happy for you, Samantha. That's excellent. Thank you for sharing that.
Dr. Benadiva did our IVF, says Michelle. We're blessed with our beautiful boy. I mean, really, the people here in Connecticut were quite lucky as far as living here in this part of the country, because the Center for Advanced Reproductive Services at UConn, you have several different locations that are convenient, and really, you're at the leading edge of science. So people can go and they know they're getting cutting edge technology and science.
We have an incredible team here. It's incredible. The physicians I work with are really top notch. leaders in the field. Our lab director and our embryology folks are really excellent. And I'm going to do a call out to our CEO, who you may have met, but he has set a culture here of fairness, of patient service, of quality, and really has pulled our center together. It's really a wonderful place to work.
That's so nice to hear. And also, as we enter into times where families are looking very different, coming in all shapes and sizes, different stages of life, you really have also reached out to the LGBTQ community, where in vitro fertilization can be important, and also the ability to freeze eggs. This is something that I was able to interview a couple couples there, and they've found it's been an effort for UConn to really reach out and be welcoming to that community.
I have loved ones in my personal life who are members of that community. And they're really important to me. This community is really important to me and to us. We take it on ourselves to make their journey as easy as possible, because we know that it always hasn't been easy. And so if we can, just make it a little bit easier and give of ourselves to make the process, and warmly receive them into our practice, it's so much fun to see the results and help couples start families.
I just want to give a shout out if people are just starting to join this feed. I am here with Dr. Daniel Groh, and we're talking about egg freezing, which is done at the UConn Advanced Center for Reproductive Services. If someone is interested in freezing their eggs, what's step one? What can someone do today?
Step one is making an appointment to speak with one of our physician team members. And, we'll go through a history and find out about your health and find out any special needs that you may have to, for the process. And I've had patients bring their mother. I've had patients bring their partners. We have sometimes professional couples who it's just not right. The time is not right for them to start the family. So sometimes we create embryos and freeze those. Sometimes we create eggs and freeze those. Sometimes we do it for cancer diagnoses. Sometimes we do it, the parents come in because they want grandchildren and they're afraid that the fertility window is going to pass for their daughter. So there's lots of reasons.
Sometimes it's grandma and grandpa saying, come on, let's go.
I know, I don't have any grandchildren yet, and I want some. So, right? I mean, if it came to that, I would happily do it.
Right. So as we talked about earlier, this is something that women can explore. The first step is to make an appointment. You might do some testing to find out the likely quality of their eggs. And again, a lot of it could be covered by insurance and certainly the healthcare spending accounts that people have. There's a lot of ways to go about this. I'd like to put the information back up on the screen. We do have a graphic just so people can visit your website. It's uconnfertility.com, Center for Advanced Reproductive Services. And thanks to the folks who've been asking or saying nice things on the feed about their little miracles that they have now, thanks to going to the center. And just remind people, people are watching from all over the state, so where they can go to get some help.
So we have our main mothership practices in Farmington, about a mile or so from the University of Connecticut Medical Campus, the health center. But we have several pretty well fleshed out satellite offices. So the Hartford office is fully functional, right near the center of downtown Hartford. We have another office in Branford, Connecticut, which I happen to be at 2 days a week, which is really a beautiful full service office, a wonderful staff, really fantastic team there. And there's a New London office, which is growing and developing. So there are 4 major locations.
And we're happy to have you here as the lead physician at the center, as well as the fellowship director there. So we appreciate you sharing some time, letting the viewers know about egg freezing. It's so interesting what science can do now. And really, there's so many options for people out there who do want to have a family. And maybe it's just they can't have it right now.
Well, thank you very much. And we look forward to helping in any way we can. And we realize that every patient is special and every patient brings their own situation. So we'll meet, we'll, dig and get the information that's necessary, do some basic testing to give you answers on, what is my fertility look like? How many eggs might I make? What is my fertility potential? And, we find that so often couples underestimate their fertility potential. And, we're here to help, make good things happen.
And just to clear up one little myth, if you do this, some people have worried, oh, aren't I losing all my eggs? And that's not the case.
Yeah, great question. So you're born, each woman, female child, is born with about 1 million eggs.
Wow.
Okay. So a lot. And I sometimes will share the fact that if you ovulate 1 egg a month from the time you're 12 to the time you're 52, you're only going to use about 500 eggs. Okay. So there's a lot of extra eggs. And there's a number of eggs preparing to ovulate every month, and not all of them, ovulate and mature. So we'll stimulate those eggs that are getting ready to ovulate the upcoming month. And there might be 5, there might be 10, there might be 20. Everyone's a little different, but that's the number. We can actually do an ultrasound and count them and see them. And we know that that's the number that you'll likely ovulate, when we go through this process.
Amazing all that you can do now. Remind everyone that they can go to yukonfertility.com. There's also a phone number, 844-467-3483. I know you're even doing some virtual appointments. So really, if people are listening and they're wondering, or grandparents are listening and they're wondering, it doesn't hurt to make a phone call, right, Dr. Groh?
We're here to help.
Okay. Thank you so much for being with us today.
Thank you for having me. This was really wonderful. It's my pleasure.
Thank you.